The EHOB Position Perfect Covered Wedges are an effective single patient use solution designed to protect patients from pressure injuries through proper sacral offloading and maintenance of a 30-degree turn. EHOB offers Position Perfect wedges in small, standard, and extra large to accommodate a variety of patient sizes and needs. The 30-degree angled Position Perfect wedges are engineered with a medical-grade urethane cover and immersive foam that contours to the patient's body. The artwork on the wedges is designed to provide a quick reference to help staff ensure proper placement under the patient. The orange ergonomic handles allow clinicians to remove from under the patient with ease. Prior to turning and repositioning a patient, first lock the wheels, lower head of bed, and raise the bed to a comfortable waist height for both caregivers. The caregiver on one side of the bed lowers the bed rails and grasps the repositioning sheet. He or she hands off the sheet to the caregiver on the opposite side while gently rolling the patient. Place the first Position Perfect wedge just above the waist area and the second just below the hip area to offload the sacrum, ensuring the wedges do not cross the patient's midline. Return the patient down onto the wedges. The Position Perfect wedges are properly positioned when you can slide your hand between the wedges to verify the sacrum is offloaded. Adjust the head of bed to the desired angle. To remove the Position Perfect wedges, use the orange ergonomic handles to first remove the wedge just below the hip area and the second just above the waist area.